it's not like one big blunder that causes all this sort of mayhem to happen. To me, it's a values proposition. Slowly over time, the values shift from, from care, human care, to health care, which means from sort of what are we inviting people into to like how can we deliver this as quickly and efficiently as possible.
Mm.
And so you can see this gentle, I don't know, degradation of kind of values, and the systems express values. And so we live in a modern culture of too much information, too fast, and so I think what we're just seeing is a expression of the values of the system in action. That's what we're back to our design idea now, right? It's so
Right.
the system's working well because the values of the system are speed and efficiency.
Right. That's a good 360. So what are the values of the system? Let's be efficient, protocol, procedure. These are the kind of banners that are carried around within the system. And of course, that's would be great if we were treating robots and if robots were delivering the care. But it's problematic when you're dealing with humans. And to your point, the complexity of this deeper desire to feel nurtured, cared for, supported. And so what you have is a lot of people who stand up and say, I'm not feeling particularly nurtured, cared for, and supported. I mean, aside from the fact that people will comment and critique all the lack of efficiencies, even despite all the effort to create efficiencies, that's a whole other narrative in terms of things. How many times I hear the word silo. I jokingly said the other day, but silos must convene and really just really hate humans. We talk so badly about silos, but we talk about silos all the time. Even in this deep desire to create efficiencies, it's like the struggle to get people to communicate and to share and to, because what we don't understand in that is those are human principles. They're not technological principles. Well, if we had data systems and information was being shared and there was shared data and open data and platforms, okay, I understand that functionally. So what's inhibiting that is the deeper question. We have all the tech. Healthcare is notorious for being technologically always behind the curve. The tech exists. No one's asking tech to invent something that doesn't already exist. The question is it reflect our values to be cultivating spaces for sharing, collaboration, interdependency? Because if those were really our priorities, I promise you those systems would have been in place 20 years ago. I think that's, it's like, so again, we misdirect our intention towards, oh, we're just technologically backward and everything is slow and it's bureaucracy. And no, it's a reflection of what we value. We're just not putting enough emphasis on this as a value system.
Yeah, and I mean, I'm not worried about robots taking over the world. I'm worried about humans becoming robots. And as always, it's not about AI and technology. We're the story. And I'm not arguing for technology. Technology saved my life. I mean, I think that's a corollary. But if it's a hot air balloon, it's human care is the balloon. It's the humans, and the technology is the container that holds everything. But we're the story. And Frederick Laloux, in his brilliant book about reinventing organizations, gives a perfect example. Buurtzorg, the nurse next door organization in, I think it's the Netherlands. And the fellow that started it was working at this place where they got in and they started creating efficiencies, and it takes 2 minutes to put a needle into this lady, and I can do 12 ladies in an hour. And he started to notice the system was sort of falling apart because the people they were serving, they got a different nurse every time, and it was speedy, and there was no care, and you had to re-explain. And so he went out and created a new organization, this sort of flat organization where little pods got together, and they kind of ran the show, and they worked in a little part of the neighborhood, and all the care came back. All the human care actually came back. I mean, an organization with, I don't know, I think they have 15,000 people now, no managers. So does it have complications? Sure, but I think this one guy sensed what human care was, and he went back to it. And
Yeah,
so this is how innovation is going to happen. And I think be very supportive of the incredible uh, technology that is available that is life saving.
yeah,
But
agreed.
machines are not going to it's they're not going to save us from ourselves.